Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Higher prevalence of mental disorder and suicidality among transgender when compared to cisgender population. JAMA study. Higher prevalence of mental disorders and suicidal behavior was found in transgender and gender diverse people when compared with the cisgender population in a recent JAMA network study. The study investigated prevalence and risk of mental disorders, substance use disorders and suicidal behaviors among transgender and gender diverse population and cisgender Canadians. The study used data from the Mental Health and Access to Care Survey, which is a nationally representative cross-sectional study administered by Statistics Canada from March to July 2022. A sample size of 9861 was included in the study. When sex at birth and gender identity matched, respondents were classified as cisgender. In the case of a mismatch, respondents were classified as transgender and gender diverse. Past 12 months and lifetime major depressive episode, generalized anxiety disorder, bipolar disorder, social phobia, alcohol use disorder and substance use disorder, suicidal thoughts, plan and attempt were assessed as outcomes. Obesity and diabetes may be risk factors for recurrence of hepatocellular carcinoma. A recent study has highlighted that the coexistence of obesity and diabetes mellitus increased late recurrence and worsened prognosis in patients with hepatocellular carcinoma undergoing hepatic resection. The findings were published in Liver Cancer. Hepatocellular carcinoma is known to have a high recurrence rate after cancer removal. Recent advances in antiviral therapy have reduced the number of patients affected, but obesity and diabetes are factors in hepatocellular carcinoma prevalence. However, these factors' effect on patient survival and cancer recurrence have been unclear. To gain insights, Dr. Hiroji Shikawa's research team at Osaka Metropolitan University's Graduate School of Medicine analyzed the relationship between diabetes mellitus, obesity and post-operative outcomes in 1644 patients with hepatocellular carcinoma who underwent liver resection. 1 in 14 patients faces harmful diagnostic errors in hospital. BMJ quality and safety. Harmful diagnostic errors may be occurring in as many as 1 in every 14 hospital patients, at least those receiving general medical care, suggest the findings of a single center study in the US published online in the journal BMJ Quality and Safety. Most of these errors are likely preventable and underscore the need for new approaches to improving surveillance to avoid these mistakes from happening in the first place, says the researchers. The researchers developed and validated a structured case review process to enable clinicians to interrogate the electronic health record to evaluate the diagnostic process for hospital patients, assess the likelihood of a diagnostic error, and characterize the impact and severity of harm. They use the process to estimate retrospectively the prevalence of harmful diagnostic errors in a randomly selected sample of 675 hospital patients out of a total of 9147 and receipts of general medical care between July 2019 and September 2021, excluding the height of the COVID-19 pandemic, that is between April and December 2020. Cases deemed to be at high risk of diagnostic error were categorized as transfer to intensive care 24 or more hours after admission, death within 90 days of admission either in hospital or after discharge, complex clinical issues but no transfer to intensive care or death within 90 days of admission. Complex clinical issues included clinical deterioration, treatment by several different medical teams, unexpected events such as cancelled surgery, unclear or discrepant diagnostics, information recorded in the medical notes. Cases deemed to be at low risk were those fulfilling none of the high-risk criteria. Clinical trial highlights synthetic cannabis, Dronabinol, Alleviates agitation in Alzheimer's patients. In a study led by the Johns Hopkins University School of Medicine and Tufts University School of Medicine, researchers show that a pill form of the drug Dronabinol, an FDA-approved synthetic version of marijuana's main ingredient, THC, reduces agitation in patients with Alzheimer's by an average of 30%. The researchers say that compared to current treatment for agitation, such as antipsychotics, Dronabinol produced similar calming effects without adverse results such as delirium or seizures. These new findings represent 8 years of work dedicated to people who have Alzheimer's as well as their caregivers, says Paul Rosenberg, MD, Professor of Psychiatry and Behavioral Sciences at the Johns Hopkins University School of Medicine and co-principal investigator for the study. Agitation is one of the most distressing symptoms of Alzheimer's dementia, and we are pleased to make positive strides forward in treatment of these patients. Although mild agitation can sometimes be moderated by behavioral intervention in moderate to severe cases, some form of medication is typically required to manage symptoms and provide relief for caregivers. It is the agitation, not the memory loss, that often drives individuals with dementia to the emergency department and long-term care facilities, says Brent Forrester, MD, Psychiatrist-in-Chief and Chairman of the Department of Psychiatry at Tufts Medical Center and co-principal investigator on the study. Dronabinol has the potential to both reduce healthcare costs and make an important positive impact on caregivers' mental and physical health. What would happen if tobacco smoking is eliminated? A Lancet public health study finds. Accelerating the decline in tobacco smoking globally by decreasing smoking prevalence from current levels to 5% everywhere could increase life expectancy and prevent millions of premature deaths by 2050, according to a study from the Global Burden of Disease, Injuries and Risk Factors. Tobacco forecasting collaborators published in the Lancet Public Health Journal. The analysis suggests speeding up progress towards ending smoking could deliver substantial population health benefits over the next 3 decades. Findings from the study suggest that based on current trends, global life expectancy will likely rise to 78.3 years by 2050, up from 73.6 years in 2022. However, if tobacco smoking were to gradually decline from current levels to a rate of 5% in 2050, this would result in 1 year of additional life expectancy in males and 0.2 years in females. In a scenario where tobacco smoking was eliminated from 2023 onwards, this could result in up to 1.5 additional years of life expectancy among males and 0.4 years among females in 2050. In both scenarios, millions of premature deaths would also be avoided. We must not lose momentum in efforts to reduce and ultimately eliminate smoking around the world. Our findings highlight that millions of premature deaths could be avoided by bringing an end to smoking, said senior author Professor Steen Emil Lancet of the Institute for Health Metrics and Evaluation. The authors produced estimates using IHME's Future Health Scenarios platform, which uses data from the Global Burden of Disease, Injuries and Risk Factors study. The new analysis provides in-depth forecast of the health burden for 204 countries, broken down by age and sex from 2022 until 2050. It is the first study to comprehensively forecast the health impacts due to smoking for all countries and all causes, as well as on 365 diseases and injuries. The main measure studied was years of lost lives, a measure of premature deaths, counting each death by the remaining life expectancy at the age of death. For example, if the ideal life expectancy is 91 years and someone dies at the age of 50, that would result in 41 years of lost lives. This is because they lost 41 years that they could have potentially lived. Life expectancy at birth and years of lost lives were evaluated under 3 future scenarios, as well as modeling a most likely future scenario based on current trends. The authors estimated the impact of 2 alternative scenarios. One assumed countries steadily reduce smoking levels among their population to 5%. The other modeled future health impacts had smoking been eliminated globally in 2023. Taking the difference between the reference and the tobacco smoking elimination as of 2023 scenario allowed researchers to measure the total future health burden that could be theoretically avoided with intervention. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.